to be looking at IV calculations. My name is Chido Muchaneta and I'm a clinical professional educator with the Academy. Right, the first things that we're going to look at with IV calculations is basically looking at some conversions, looking at common IV drug dosage formulas, looking at drip rates, looking at some different types of concentrations, as well as complex IV drug calculations along the way with weight. We'll start off today with conversions. Now, when you look at conversions, you need to think of them sort of in descending order to the smallest value of nanograms, in ascending order to the largest value of kilograms. However, typically if you are giving kilogram doses to the patient, potentially they would be dead. And if you are giving nanogram doses to the patient, they would be a very, very small patient. So maybe more so relevant with neonates or babies. Where we tend to live as adult nurses is grams, milligrams, and micrograms, with nanograms being at the bottom and kgs being right at the top. In terms of moving in between them, you're either multiplying by 1,000 or you're dividing by 1,000. If you're more comfortable moving decimal places, then it's 3 decimal places to the right or to the left, subject to whether you're moving from big to small or small to big. A quick example is converting 3 grams to milligrams. So as I've shown you earlier, it becomes 3 times 1,000, giving us 3,000 milligrams, or alternatively, if we were thinking of decimal points, then it's 3 decimal points to the right. Again, you can see how that arrow flows, and it gives you the exact same answer, which is 3,000 milligrams. So that covers the basics of conversions. Now you can do some quick examples for yourself just to get comfortable with it, and I'll just run through a couple just to give you a chance to practice. So think of converting 0.75 milligrams to micrograms. Again, for that one, specifically what you would be doing again is multiplying by 1,000. So 0.75 times 1,000 would give you 750 micrograms. Last one, converting 500 milligrams to grams, making it bigger. So in that situation, you'd be dividing by 1,000, giving you 0.5 grams. Last one, 1.5 liters. Divided to convert that to milliliters, again you'd be multiplying by 1,000, which would give you 1,500 mils at the end of that. So those are some quick examples of potentially how you might choose to convert. We're looking at IV drug dosages. So with IV drug dosages, our focus is usually what I want over what I've got times whatever solution it comes in. Now, if you're familiar with the acronym NHS, what I want, or my prescribed dose, is usually represented by the N, so needed, required, or prescribed dose, and then the H representing whatever I have in stock, representing what I've got, and S representing the solution that it comes in. So that's an easy mnemonic of remembering what I want over what I've got times the solution it comes in, if you find that complicated. Now we're giving a dose of aminophylline, 170 milligrams for instance, and we have a stock of 250 in 10 mils. Now, just thinking about it from the very basic level, what you want is going to go on top. So that's the 170 milligrams that you're going to be giving, divided by the 250 milligrams, which is what you have in stock that comes in the 10 mil solution. Again, if you're not comfortable crossing off zeros, then don't cross off zeros. For most things, you can use a calculator. And basically what you're doing is dividing 170 by 250 and multiplying that by 10 and entering that information to your calculator should give you the answer 6.8 mils. If you're comfortable simplifying or crossing off zeros, then obviously whatever you do on top is what you do at the bottom. Should simplify to 34 divided by 5, which would still give you 6.8 mils in terms of the volume that you will be administering to the patient. Another quick example for that is you need to give the patient 120 milligrams of drug. You have stock supplied as 25,000 micrograms in a mil. Again, real quickly, I think in terms of whatever it's comfortable for you to convert to, that is what you will choose. So if you have been programmed to convert everything to milligrams, then that becomes 120 over 25 times 1. Alternatively, if you've been programmed to convert everything to micrograms, then it's basically 120 times 1,000, giving us 120,000 divided by 25,000 micrograms. And all we're doing is removing the zeros and dividing 120 by 25, giving us 4.8 mils as the volume that we would administer to the patient. Move on to the next section, which focuses on what I call percent solutions. Again, people usually ask me that question, Chido, when have I ever used a percent solution? And I always say to people, as often as you put up a bag of fluid for a patient, typically you don't think of what's in a bag of fluid. But let's take, for instance, normal saline. All we're talking about is we're measuring the grams of sodium chloride for every 100 mils in, say, a liter bag or a 100 ml bag, whatever the case may be. So if it was a 0.9% solution of saline, it basically would represent 0.9 grams of sodium chloride for every 100 mils of water. So in terms of percent solutions, I would like you ideally to visualize a red billboard that sort of talks about grams in 100 mils, because that's essentially how you would express percent solutions. So if it was a 1% solution, automatically it would represent a gram in 100 mils. Now, the example that we've got on the board is for a 0.5% solution. And the question is actually asking us for milligrams in a mil for a 0.5% solution. Now, my advice is always to quantify in terms of grams in 100 mils to start off with. So 0.5% expressed as grams in 100 mils is 0.5 grams in 100 mils. Second step is to simplify. All I mean by that is to convert your grams to milligrams. So 0.5 grams quickly converts to 500 milligrams in 100 mils. So now we know that there's 500 milligrams in 100 mils. What we're trying to find out is how many milligrams are in 1 mil. We're going to divide our 500 by 100, giving us the final answer of 5 milligrams in a mil. I've basically done it for you in the step-by-step format so that you don't get lost and you don't get confused along the way, because sometimes if you automatically try and do it just by seeing the first element of the question, it can be confusing. So if that's you, try and simplify it or break it down in the 3 steps. So first step, quantify in terms of grams in 100 mils. Second step, simplify. All I mean by that is convert everything to milligrams. In this case, 0.5 grams becomes 500 milligrams in 100 mils. Last step is to divide to get our milligrams for 100 mils. So 500 by 100, giving us a final answer of 500 milligrams for every mil. Moving on from there, we're going to look at something a little bit different, but also typically a little bit common to us. We call them ratio solutions. I'm just going to put a little heading for us here so that we're just clear on what we're talking about. Now, with ratio solutions, the key point to understand is we use them when we are giving something for anaphylaxis, typically adrenaline or epinephrine, depending upon which side of the pond you come from. Alternatively, we also use adrenaline when we are trying to resuscitate a patient. Now, I've got the 2 strengths here. So one strength you will typically use for anaphylaxis. The other strength you will typically use for resus. I've got allergy there representing anaphylaxis, just so that it's a mental reminder for myself. The strength for allergy purposes will always be your 1 in 1,000. Your strength for resus purposes will be your 1 in 10,000. What does it mean, 1 in 1,000, 1 in 10,000? Essentially what it breaks down to is a gram in 1,000 mils for the 1 in 1,000 concentration. Alternatively, it's a gram in 10,000 mils for your 1 in 10,000 concentration. Now, I find it difficult to visualize a volume of 10,000 mils of volume because I've never given that in one go to a patient. So my guess is the same would be consistent for you as well. So I like to break things down to the smallest possible volumes so that they become relatable to myself. So a gram would signify 1,000 milligrams in 1,000 mils. Alternatively, for a 1 in 10,000 strength, it would be 1,000 milligrams in 10,000 mils. My second step from that, after expressing that in terms of milligrams in mils, is to simplify, or basically what I mean is remove the zeros and get the value for a milligram. Now, if you cross off 3 noughts on this side and 3 noughts off on this side, then a milligram for your 1 in 1,000 strength is equivalent to a mil. So typically, in your anaphylactic kit, you would always get a milligram in a mil of adrenaline. And based on what you would give in a community setting is in the initial first phase of anaphylaxis, you would give 0.5 milligrams, which would be equivalent to 0.5 mils, because it's essentially a 1:1 ratio. And then you would give the second 0.5 after a couple of minutes if that wasn't working, and that would total the milligram in a mil. And that is how the process would work for anaphylaxis. So it's essentially a 1:1 ratio. I usually say for any ratio related question where the strength is 1 in 1,000, essentially 1:1, the question is always the answer in the other unit of measure. So if it was asking you for 5 milligrams, the answer would be 5 mils is what you'd be administering. If it was asking you for 0.5 milligrams, then you'd be giving 0.5 mils in the other unit of measure. So always think of it in terms of 1:1 for a 1 in 1,000 strength. If it reflects to resuscitation, now some of you may be more familiar with this if you worked in a more acute setting. However, some of you may not necessarily be familiar with this because maybe your setting is community-based. Key things to think about is, again, you would cross off zeros. So 3 zeros off on that end, 3 zeros off on that end. A milligram becomes equivalent to 10 mils. So it's essentially a 1:10 ratio. So I would say for questions relating to your 1 in 10,000 strength, it's usually the question times 10. So take, for instance, if you needed to give the patient, hypothetically, 0.2 milligrams, essentially how many mils would you be giving the patient? So if you think about it, 0.2 milligrams is what you needed to give. Times 10, that means whatever you would be giving to the patient in terms of volume would be 2 mils, because it's a 1:10 ratio. So for any question relating to the 1 in 10,000 strength, it's always the question multiplied by 10, giving you the answer. So that essentially summarizes what we're looking at for ratio solutions. I'm going to look at something a little bit different, and it focuses on different concentrations or expressed concentrations for drug. Let's take the question, for instance. Your patient has been prescribed a dose of 500 milligrams of acyclovir. This has been reconstituted with water for injections, giving a final concentration of 5 milligrams in a mil. Now, if you were looking at this question, the question is how much fluid has been used to achieve this final concentration? So what we're trying to actually look for is the volume that we've used to end up with 5 milligrams in a mil. Now, I always say anytime a math problem has more than 3 sentences or is incredibly wordy, you can be rest assured that the words are there to confuse you. You need to specifically focus on the numbers and try and weed out the information from the question. So we need to give 500 milligrams. We have a concentration of 5 milligrams in a mil, and that's basically the solution that it comes in. So if you're using that same formula, what I want over what I've got times the solution it comes in, then your overall answer should give you 100 mils. And that's basically how you would get to that answer. I always say, take out the noise and focus on the numbers, and then make a decision on what you're doing with the numbers in that moment in time. Another question maybe that you could think about is you need to give a gram of vancomycin. A gram of vancomycin translates to 8,000 milligrams if you convert that to milligrams. And you need to give that at a rate of 10 milligrams per minute. Again, maybe what people are tempted to do in this situation is to convert the minute to seconds. Now, I would always say strongly resist that temptation. If the number hasn't been mentioned in the question, don't add it to the question or the equation. Always kind of stick to what the information is actually asking you for. So you've got a gram of vancomycin, which translates to 10,000 milligrams, going at 10 milligrams per minute, keeping it 1 minute. So typically what you would do is cross off your zeros and end up with 100 minutes as the amount of time it would take you to give a gram of vancomycin. Now this gram of vancomycin has been added to a compatible infusion fluid, 250 mils, and made to run over the 100 minutes that we've calculated. The question now is a little bit different. What is your infusion rate in mils per hour? Now take note, although I've given you a whole heap of information, there are potentially some numbers that are specifically irrelevant in that question. For instance, the 1,000 milligrams is irrelevant because we're not looking for milligrams per minute, we're looking for mils per minute. So what we're actually thinking about is the volume divided by the time to give us the mils per minute multiplied by 60 to give us the mils per hour. And essentially what that represents is 250 divided by 100 giving us 2.5 mils per minute multiplied by 60 giving us 150 mils per minute. And that completes the answer for that question. So we've looked at rates, we've looked at concentrations. We're now going to move on to more complex IV infusion questions. The question states that you need to give some GTN at 10 micrograms per minute. You have prepared a 50 milligram and 50 ml solution. And the question is, what is your infusion rate in mils per hour? Again, slightly tricky, but I always sort of say, go back to your basics. Think about your foundation for a minute. So what I want over what I've got. Now, I like to label all my numbers with an acronym because then I know exactly where they're going when I'm writing them out. If you're that type of person who needs to do that, then do that for you. If you can easily do that in your head, then you might as well do that in your head. But some of us are not like that. So I need to actually write it down and look at it to begin to actually calculate it. So I've got 10 micrograms per minute. This is what I want to give. I've got 50 milligrams in 50 mils, and that's my solution. So that's what it comes in, the 50 milligrams in 50 mils. However, I need to give it over 60 minutes. So at some point, I'm going to need to multiply by 60 because initially I gave you micrograms per minute. Now, looking at it real quickly right now, you can begin to see some slight anomalies. For instance, I've got micrograms on top, and then I've got milligrams at the bottom. So in that instance, I need to convert one to look like the other so that they can begin to communicate. And how I'm going to achieve that is merely by multiplying by 1,000. Again, I will always say converting is dependent upon the user and what your programming best thinks is accurate for you. So if you're used to converting everything to micrograms, then first and foremost, it becomes 50 times 1,000, giving us 50,000 micrograms. So it's 10 divided by 50,000 micrograms times 50 times 60, which once simplified gives you 30 over 50, giving you the answer 0.6 mils per hour. Alternatively, if you favor converting everything to milligrams, then 10 micrograms becomes 0.01. divided by 50 milligrams times 50 mils times 60. If you recognize patterns early on, you know that those two 50s cross each other out. So it's essentially 0.01 times 60, giving us 0.6 mils per hour. Exactly the same answer. So it doesn't matter which one you favor to convert to. As long as you do it correctly, you should still end up with the same answer or in the same place. Other common mistakes that people make is that they convert the wrong way and they multiply your 10 micrograms by 1,000. So the number on top becomes exponentially bigger than the number at the bottom. With complex IVs, the number on top can never be exponentially bigger than the number at the bottom. Always remember that at the back of your mind. If that's what's happening for you, then it suggests maybe that you've gone the wrong way. So always come back and have a look at it again. Similarly, if you're converting on this end, the number at the top must not be bigger than the number on the bottom, because again, it suggests that something has gone horribly wrong in the calculation that you're doing. Anyways, our answer for this question becomes 0.6 mils per hour. We're going to do another similar question. However, now we're going to focus on an added component of weight. So your patient has been prescribed 5 micrograms of dobutamine. You have prepared a 250 milligram in 50 ml solution. Your patient weighs 70 kilos. And the question is, what is your infusion rate in mils per hour? So you've got 5 micrograms per kilo per minute. That's what you want to give. In terms of what you've got or what you have in stock, you have 250 milligrams in 50 mils. Again, using that foundation formula. What I want over what I've got times the solution it comes in. However, because this has been given to me as micrograms per kilo, I need to multiply that by the patient weight. So at some point, I'm going to need to multiply by 70. Alternatively, you can also think about, yes, you need to multiply by 60 because I gave you micrograms per minute. However, I'm asking you for an administration in mils per hour. So step 1 again relates to performing those conversions so that these two can start to speak together. So again, user's choice. You may choose to convert that to micrograms, in which case it becomes 250,000 micrograms. So it's 5 times 50 times 70 times 60 divided by 250,000 micrograms. Simplified, it's 42/10, giving you the answer 4.2 mils per hour. If you were using your calculator, you'd be merely entering that data into your calculator. Alternatively, if you prefer to convert everything to milligrams, then 0.5 micrograms becomes 0.005 divided by 250 times 70 times 60 times 50, giving you a final answer of 4.2 mils per hour. I like to think of it in terms of something that I'm comfortable doing every day. So for the ladies, I would always say, visualize you're putting on your makeup. What I want over what I've got times the solution it comes in is my foundation, and then I need my blusher and my lipstick, and I can step out of the door. I always give everything a label because I need to make it very relatable and practical for the day-to-day activities that I'm doing. Alternatively, if you're a guy, then think of it as practically as you can be. What I want over what I've got times the solution it comes in is the house I live in. However, I cannot live in my house without any electric or plumbing. So that gives it a more relatable aspect for you to sort of think about in terms of how you might choose to break that down. So the final answer for this question would be 4.2 mils per hour. The last section is going to focus on what we call drip rates. Now, if I'm honest, I don't know if many nurses still stand at the bedside and calculate drops per minute in terms of how many drops are falling for the patient. What I do know most practitioners do is they eyeball it and think that is too fast or that is too slow based on the rate that they've been given, or the rate that that dosage has been prescribed for. But typically, if you were thinking about giving a liter of Hartmann's or saline over 6 hours, and your drop factor would automatically be 20 drops per mil because it's a crystalloid, then you might think about how you might want to do that. Now, my advice is always to do the top half first, and then go ahead and do this bottom half next, and then divide the two to get to the correct answer. Now, some of you may choose to do it individually. However, sometimes I find if you're entering into a calculator, the calculator just gets rid of the decimal points excess and maybe gives you a number that is slightly short or maybe slightly insufficient. So I always say maybe do the top first and then do the bottom next and then divide. So my volume times the drop factor first will give me 20,000. And then my time times the number of minutes in an hour, to convert that to minutes, giving me 360 minutes. And then dividing by that, which will give me the answer 55.55555 recurring. Now, in terms of answers that are easy to accept, I will always accept 55.5 or 55.55, closest to the first or second decimal points. If you're not comfortable rounding off, if you are comfortable rounding off, then it's thinking about rounding off to the nearest whole drop. And anything that is 5 and above will be considered a whole drop, and the nearest for that will be 56 drops per minute. Another one just to look at that might be slightly different from that is that you need to give 100 mils over 30 minutes. Drop factor is 20 drops per minute, 20 drops per mil. Now there's two different ways you can potentially think about calculating that. One thing to think about is you already have the minutes, so you don't need to multiply by 60 because this is already expressed in minutes. So you don't need to tinker with it any further. So it's simply 100 times 20 divided by 30, which should give you 66.666 recurring. Closest to the first decimal point is 66.6 drops per minute. Alternatively, round off to the nearest whole drop is 67 drops per minute. However, some of you might choose to think of it differently. You may choose to quantify 30 minutes as a fraction of an hour. Now, if you quantify 30 minutes as a fraction of an hour, then you need to pay homage to the hour. The 60 counts is all I'm saying. So it then becomes 100 times 20 divided by 0.5 times 60. It should still give you the same answer depending on how you've done that. Now, just a quick point of reminder for anyone who's calculating specifically these types of questions. This formula works quite neatly for 15 minutes, 45 minutes, and 35 minutes. If you're given something random like 47 minutes, it throws this little method into a little bit of spasm, or it might make it potentially more complicated with several decimal points. I would suggest using the method on top. Keep it simple and straightforward. And that way, you're likely to get to the correct answer. Just use the minutes that you have, and that should take you to the correct answer. That brings us to the end of this calculation session. However, little notes for your test. Always make sure you've got the correct unit of measure at the end of the test. So if your question is asking you for milligrams, then make sure you've got your answer and the milligram icon behind that. If it's asking you for mils, make sure you've written 100 mils as the answer. If it's asking you for drops per minute, then it is drops per minute at the answer. Always sense check your answers if you can. If you got an opportunity to revise and go through your content once again, if you're writing a test, then do that, because that will help you in terms of answering a test or getting through a test. Other useful tips are, if you open up your test page and you draw a blank on the first page, flip through the test and find a question that you're quite comfortable answering. It will give you the confidence to continue with the rest of the paper once you settle down and you've calmed your nerves. You can always go back to the slightly more complex questions, and you'll find that they're easier to answer if you've tackled it using questions that you know to begin with. Thank you. See you next time.